Thanks so much for that, Morgan.
Sure.
Well, more people are turning away from traditional medicines in favor of taking a more natural or holistic route. And is it always better? We have one doctor here today who says that your current doctor may not be solving what's really wrong with you, especially if you're a woman. Dr. Stephen Hotze, author of Hormones, Health, and Happiness, is here with us in the studio with more. And here is a copy of the book. Thank you so much for being here. I'm excited to have you.
I'm glad to be here. Thank you for inviting me.
Now, you originally you studied traditional modern medicine, and then you kind of switched into this holistic approach. What made the change?
Well, I went to the University of Texas at Houston. It was trained in the paradigm that if you have a disease, you either treat them with drugs or you treat them with surgery. But after being in medicine, I found out it didn't work. Why not help people get well so they don't need drugs and need surgery? So I wrote this book for you and for every woman who's been treated like she was a hypochondriac, a neurotic, or hysteric by her physician for problems of low thyroid and hormonal imbalance that go undiagnosed.
Now, hormonal imbalance in women has been in the news because of Brooke Shields and her postpartum depression, and then Tom Cruise's rebuttal to that. What would you say to someone like Brooke Shields, and what's your opinion on that?
Well, first, Brooke Shields did a great job by seeking help when she felt depressed after she had her baby. The cause of the depression is a decline in progesterone. Progesterone is the hormone of pregnancy. It's created at 10 to 20 times the amount during pregnancy by the placenta, which is controlled by the baby. When the baby's delivered and the placenta is delivered, there's a precipitous drop in progesterone, which leads to these feelings women will have, oftentimes postpartum blues. If the ovaries don't kick back in, they get postpartum depression. Now, you have two choices. Treat it with drugs, which I'm totally opposed to, or treat it by giving natural progesterone and a little bit of thyroid. So in our patients that are pregnant, we tell them as soon as you have that baby, you start on progesterone and you'll do fine. And as a matter of fact, I have 5 daughters, 3 of whom have kids, and every one of them takes progesterone after she has the baby.
Now, what's the difference between a natural hormone and the medicines that doctors might put you on?
Well, hormones are chemical messengers that are created in our body by the thyroid gland, which is a commonly undiagnosed problem. Women commonly have low thyroid problems that are untreated. Of course, the hormones are also made in the ovaries, testicles, and the adrenal glands in individuals. Those are natural. They occur in our bodies. Drugs are chemicals that never existed before in nature. And somehow they're supposed to treat our problems. Well, if a person's depressed, it's not because they have low levels of Prozac or Effexor or any other antidepressant.
Right.
They're depressed because something internally has changed, and that's normally and commonly the hormones. And what can be simply done is to replenish those hormones. 2 choices. You can use a counterfeit hormone made by drug companies, or you can replenish it with the natural, biologically identical hormones, which can be prescribed by a physician and then prepared at a pharmacy, compounding pharmacy.
Now, the hormonal problem in women is not just a problem after birth, it's also later in life, middle age, menopause, same thing?
Right.
Same hormones?
Well, the hormone problems can occur right at puberty. There are many women that tell me, I wasn't right after I started having my periods. Things just never were right. Sometimes after they took birth control pills, sometimes after childbirth, very commonly. And then as we march through, our woman marches through her menstrual life, as she approaches the change, the hormones decline and become imbalanced. And what we want to do is balance those. And if you do that, then you can give a woman an opportunity to obtain and maintain health and wellness naturally so they enjoy a good quality of life as they mature.
Well, I'm so excited that you were here. And again, the book is Hormones, Health, and Happiness. And you're having a book signing tonight, right? Or tomorrow night.
Tomorrow night at Birkdale.
At Barnes & Noble.
Barnes & Noble in Birkdale, which is up in the hills. What area?
It's down South Charlotte. Up North Charlotte, near Lake Norman.
Right.
Near Lake Norman, it's Huntersville. Exit 23, I believe.
And also the book's available on Amazon.com, Barnes & Noble, and or you can go to drhotze.com, drhotze.com.
Hotze, okay. Yes. Fantastic. Well, it's a pleasure to have you here, and thank you so much for taking the time.
My pleasure to be here.
Have a fantastic day. And still